One of the ways that Cincinnati Children has really been a leader in mental health was through the establishment of this College Hill campus. We have inpatient facilities, we have outpatient facilities. This is a very unique campus that really addresses the needs that the kids have. But over the last 20 years, despite the fact that we've been a leader in mental health, we still face an uphill battle.
Tragically, about 1 out of 10 children is disabled because of their mental health disorder.
Suicide is the second leading cause of death in kids between the ages of 10 to 24. We are seeing more kids have mental health challenges and crises than we've ever seen before.
And across our country, the majority do not receive the care they need. And so this is really something that really extends to all cultures, all populations, all regions.
In 2013, my wife and I adopted 3 daughters from Monterrey, Mexico. Little did we know the journey we were about to be on. We had no idea of the level of trauma our daughters had experienced and how that would manifest itself back out into our family, into the community, and even for themselves. Melanie not only went through a significant amount of trauma, but she also had neglect. I remember the day she had an emergency intake, the day that actually led to her residential care was the day that I realized that I could not keep her safe, even from herself. And I said, okay, we need to take that next step and move towards residential care. So we made a decision. She spent probably 5-6 weeks in acute crisis care until we could move her to residential at Children's. It's really hard.
People can come in really very desperate situations or very difficult challenges, but with treatment and dedication and time and hard work by both the family and oftentimes the provider, things can get so much better.
We work with a diverse group of patients who need love, care, support. Building rapport with patients to help them trust us and know that we are here to support them, because they meet a lot of people when they come into the hospital.
They come from every neighborhood, every school district, every type of background, every economic level. These are problems that affect everyone, every family.
Well, it started when he was 4 because he had some motor delay. Then I started noticing the social piece, being able to communicate. But as he got into that middle part of elementary, a lot of the bullying took place. He started having some behavior meltdowns, and he would push things down, knock things down, yell a lot. And to see that as a parent, it was hard for me. I would cry a lot. Just kept asking, what could I do? What is wrong? What did I do? So it went on and on and on for like a whole school year like that, not being able to communicate his needs and wants. He kept more stuff inside, and it was building up, and then he just popped. So I just drove him straight to Children's, and they took him in, and they sent him over to North College here. He needs somebody to understand that what was going on with him was his autism and his communication and his social skills.
When we first launched the College Hill facility, the concepts of what kids needed and what families wanted was still in evolution. And the building did a wonderful job for the type of care we needed to deliver at that time. But over time, we've really realized the value and the importance of incorporating families more into that inpatient experience.
When we were at our high census, and if the patients are doubled up in the room, the families are not allowed to stay because there's no bed for them to sleep in. So that's a big challenge for us.
So much of our treatment really involves not only working with the young person, but working with the parents or other caregivers who may be involved, and their ability to have a space to be here and work with us on that. We think would take our treatment tremendously, advance it for the future. Philanthropy is really critical to what we do. In many ways, we've been very fortunate to have great generosity from many groups here in the city, especially the Convalescent Hospital Board. They've supported the development of psychiatry over many years.
They have stepped forward again to help us with our vision and our imagining of how we could even enhance the College Hill facility.
When I think about what College Hill's done for us, like we have confidence, we have a team, there's people that are listening to us, it's dependable. It's not just a crisis for the kid, it's a crisis for the family as a whole. And that's why I would probably encourage people to donate.
You're investing in the lives of the patients when you're donating. It's not just about giving money. You are really helping to care and love.
He's doing great now. I think the skills and the therapy has helped.
So many times we're really challenged by really deciding where we want to make investment, where we want to kind of place our goodwill. One thing to think about is that the issues that affect children, mental health is probably the biggest one. I can't really think of a better investment.